Have you ever stepped outside and watched your dog make a beeline straight for the lawn, ignoring the toys, ignoring you, just head down, chomping on grass like it's the best meal of the day, and thought to yourself, what is going on with this animal? I hear this question from clients in my clinic every single week, and the answer is so much more interesting than most people expect. Because here is what I need you to walk away knowing. The most common explanation you have probably heard, that dogs eat grass to make themselves vomit when they feel sick, is not really supported by the science, not even close. Hi, I am Larissa, I am a veterinarian, and today I want to break down the real science behind why dogs eat grass, what it usually means, and, most importantly, how to tell the difference between a completely normal behavior and an early warning sign of something that needs medical attention. If you have a dog, this one matters. Stay with me until the end of this video because the signs I am going to describe are exactly the kind that are easy to miss until things get complicated. And whether your dog eats grass occasionally or every single day, this content is for you. Let me start by giving you some real context because this behavior goes a lot deeper than most people realize. Eating grass is so common in dogs that it actually has a scientific category. It falls under a broader behavior called pica, which refers to the ingestion of non-food materials, and more specifically, it is a type of plant-eating behavior that researchers refer to as herbivory in carnivores. And here is what I find genuinely remarkable about this. It is not just domestic dogs. Wild wolves, coyotes, foxes, and free-ranging dogs have all been documented consuming grass and other plant material. Studies analyzing wolf fecal samples have found plant material, mostly grass, in a significant percentage of them. This behavior has been part of the canine lineage for a very long time, which means we cannot simply dismiss it as a sign that something is wrong. It has evolutionary roots, and understanding those roots is the foundation for understanding your dog. Now, the dog's digestive system is built primarily for processing animal protein and fat. The stomach produces hydrochloric acid and proteolytic enzymes to break down meat efficiently. The small intestine absorbs nutrients through specialized projections called villi, and the large intestine manages water reabsorption and stool formation. What dogs do not have is the extended fermentation system that true herbivores, cows, horses, sheep, use to extract nutrition from plant material. A dog's gastrointestinal tract is relatively short, proportional to a meat-based diet. This is important because when a dog eats grass, it is not doing it for the same nutritional reasons an herbivore would. It is doing it for other reasons entirely, and those reasons are what I am about to break down for you. Here is the data point that I think is most important for you to know today. A landmark study published in 2008 by Sueda, Hart, and Cliff, one of the most cited papers on this topic, surveyed over 1,500 dog owners and found that 68% reported their dogs ate plants regularly, with grass being by far the most common choice. And this is the part that surprises people. Less than 25% of those dogs vomited after eating grass, and only 8% appeared ill before the behavior occurred. So the idea that grass eating equals a sick dog trying to purge, that simply does not hold up statistically. Most dogs eating grass are not sick, and most do not vomit afterward. The vomiting is the exception, not the rule. And yet this myth persists, which concerns me as a clinician, because it causes owners to dismiss the behavior when it occasionally does carry a signal worth acting on. It is also worth noting that younger dogs appear to eat grass more frequently than older ones, and dogs with lower dietary fiber intake tend to do it more. These patterns are not random, they point directly to the mechanisms I am going to explain right now. Now I want to take you deeper into the why, because this is where the science gets genuinely fascinating. The behavior of deliberately consuming plant material for physiological purposes actually has a name in behavioral biology: zoopharmacognosy. It is a big word, but the concept is simple. It describes the ability of animals to self-medicate using plants, soils, and other environmental compounds. And there is real evidence that dogs eating grass may be at least partly an expression of this ancient capacity. The most compelling evolutionary explanation comes from research by Benjamin Hart and colleagues at the University of California, Davis. Their intestinal parasite purging hypothesis proposes that grass fiber increases intestinal motility, essentially speeding up the movement of contents through the gut, and that this mechanical action helps dislodge and expel intestinal parasites. Data from wild canid populations suggested that animals with grass-eating behaviors showed higher rates of parasite clearance. Over evolutionary time, this trait appears to have been selected for because it increased survival. So when your domestic dog eats grass, one possible explanation is that its gut is doing exactly what its ancestors' guts were programmed to do, sensing something internally and trying to manage it. The second mechanism is more straightforward and probably accounts for the majority of grass-eating episodes in healthy domestic dogs: dietary fiber supplementation. Many commercial dog foods, particularly dry kibble formulations, are relatively low in plant-based fiber. Fiber is critical for intestinal motility, stool consistency, and the health of the colonic microbiome. When fiber intake is insufficient, gut transit slows, and dogs may instinctively seek out plant material to compensate. This aligns with the observation that dogs on higher fiber diets tend to eat grass less frequently. Now, and I need to be completely clear about this, these natural, evolutionarily grounded mechanisms coexist with a completely different set of triggers: gastritis, gastroesophageal reflux, inflammatory bowel disease, exocrine pancreatic insufficiency, active intestinal parasitic infection, and behavioral pica driven by anxiety or boredom can all produce the same grass-seeking behavior. This is why I never dismiss it without looking at the full picture. The behavior is not self-diagnosing. It is a signal, and the context surrounding it is everything. Here is where I need you to pay close attention, because this is the part of this video that can genuinely change the health outcome for your dog. Occasional casual grass nibbling in an otherwise thriving dog is generally not a concern. What I want you to watch for is the pattern around the behavior, what accompanies it, how it looks, and whether it is changing over time. The first sign is urgency and intensity. A dog that seeks out grass with focused, almost frantic determination, head down, eating rapidly, not distracted by anything around it, is expressing something fundamentally different from a dog that lazily chews a few blades during a walk. Urgency suggests active gastrointestinal discomfort. The dog is trying to relieve something it is feeling internally, and that purposeful behavior is a clinical signal. The second sign is consistent vomiting after grass eating, not occasional, consistent. When a dog repeatedly eats grass and then brings up yellow or greenish fluid, this pattern points to bilious vomiting syndrome, which is related to bile refluxing into an empty stomach, or it can indicate gastritis or a gastric motility disorder. Bile vomiting that occurs specifically in the early morning, before the first meal, is a particularly specific sign that deserves veterinary investigation rather than a wait-and-see approach. The third sign is concurrent stool changes. Mucus coating the stool, very soft feces, intermittent diarrhea, or alternating constipation and loose stool alongside grass eating. These together point toward large intestinal disease, inflammatory bowel disease, or a parasitic infection. I never assess stool changes in isolation, and I never assess grass eating in isolation. It is the combination that tells the real story. The fourth sign is weight loss or poor body condition alongside the behavior. If your dog is eating grass frequently, and you are also noticing gradual muscle loss, a dull or brittle coat, reduced interest in its regular food, or large volume soft stool that seems out of proportion to what it ate, this constellation strongly suggests malabsorption. Exocrine pancreatic insufficiency, a condition in which the pancreas fails to produce adequate digestive enzymes, is a classic and frequently missed cause. These dogs cannot absorb nutrition properly regardless of how much they eat, and they often compensate by seeking out any additional material, including grass. The diagnosis is often delayed by months or even years because the signs develop gradually, and each one individually seems explainable. The fifth sign is behavioral compulsivity. When grass eating becomes a repetitive, difficult to interrupt behavior in a dog that also shows other anxiety-driven signs, excessive licking of surfaces or paws, pacing, destructive behavior when left alone, hypervigilance, then we are dealing with behavioral pica, which is a completely different problem requiring a completely different approach. The sixth sign is abdominal discomfort occurring outside of the grass-eating episodes themselves. A dog that is restless after meals, repeatedly looks at or licks at its belly, shifts positions frequently as if trying to get comfortable, or adopts a guarded, hunched posture. Any of these, combined with grass eating, tells me I need to investigate internally. The World Small Animal Veterinary Association's clinical guidelines for gastrointestinal disease in dogs specify that recurring signs lasting more than 3 weeks constitute chronic gastrointestinal disease and warrant a structured diagnostic workup. Grass eating alongside any of the signs I have just described would meet that threshold. Let me be direct with you here, because recognizing the signs is only half the equation. The other half is knowing what to actually ask your veterinarian for when you walk through that door. Because grass eating is such a non-specific behavior that the diagnostic workup needs to be structured and purposeful. The starting point is always a thorough clinical history, and I mean genuinely thorough. How long has the behavior been happening? Is it increasing in frequency? What does it look like? Casual or urgent? What does the stool look like? What is your dog eating and in what quantities? Any changes in body weight or energy level? Any other animals in the household? Recent travel or contact with unknown dogs? This conversation is not small talk. It is the foundation of my differential diagnosis. From a laboratory standpoint, the core panel I recommend when investigating problematic grass eating includes a complete blood count, a full biochemistry panel, a urinalysis, and a comprehensive fecal examination. I want to emphasize that last point specifically. A standard fecal flotation is not sufficient to rule out all parasitic causes. Giardia, one of the most common intestinal parasites in dogs worldwide, requires antigen testing or PCR for reliable detection. A negative standard flotation does not rule out Giardia. This is a diagnostic gap that causes real delays in treatment. For dogs showing signs of malabsorption, weight loss despite maintained or increased appetite, large volume soft stool, deteriorating coat condition, I add serum trypsin-like immunoreactivity, or TLI, to the panel. The TLI is the established gold standard test for exocrine pancreatic insufficiency, a fully treatable condition that is notoriously underdiagnosed in general practice. I also measure serum cobalamin and folate together because these two vitamins are absorbed at different regions of the small intestine, and their combined values give me a functional map of where absorptive capacity is impaired. For dogs with bilious vomiting, reflux signs, or any dog with chronic gastrointestinal signs who has not responded to initial management, I recommend abdominal ultrasound. Ultrasound allows me to assess the thickness and layering architecture of the intestinal walls. Changes in wall layering are a key finding in inflammatory bowel disease and, in older dogs, intestinal lymphoma. It also gives me a view of the pancreas, mesenteric lymph nodes, and liver, all of which can contribute to the gastrointestinal picture I am working to understand. The WSAVA recommends annual wellness blood panels for adult dogs and twice-yearly screening for dogs over 7 years of age. Mentioning grass-eating behavior at a routine appointment, especially if it has been increasing in frequency or intensity, gives your veterinarian important clinical context that may change what gets included in that panel. Now I want to talk to you about management the way I talk to clients sitting across from me, with honesty first. If your dog eats grass occasionally and is completely healthy in every other measurable way, perfect energy, stable weight, normal stool, no vomiting, a full clean bill of health on physical exam and blood work, then there is nothing to treat. The behavior itself is not a disease. In a healthy dog, it is simply your dog doing something dogs have done for thousands of years, and the most important thing you can do is make sure the grass it is accessing is safe. But when there is an underlying condition driving the behavior, and in dogs with compulsive, urgent, or sign-accompanied grass eating, there very often is, then management has to be diagnosis-specific. Guessing is not a strategy. For dogs diagnosed with inflammatory bowel disease, The most commonly confirmed chronic gastrointestinal condition in dogs, dietary modification is always the first cornerstone of management. Hydrolyzed protein diets, novel protein diets, or highly digestible formulations reduce the antigenic burden on an inflamed intestinal wall and can produce significant clinical improvement. A study by Allensbach and colleagues published in the Journal of Veterinary Internal Medicine found that dietary intervention alone achieved clinical remission in a meaningful subset of dogs with IBD before any immunosuppressive pharmacotherapy was introduced. In more severe or refractory cases, anti-inflammatory or immunosuppressive agents are added, but diet is always part of the conversation. For exocrine pancreatic insufficiency, the treatment approach is enzyme replacement, powdered pancreatic enzyme supplements mixed directly into every meal. The clinical response to this treatment is often dramatic and relatively rapid. Many owners describe their dog as looking like a completely different animal within 2 to 4 weeks of starting therapy. Cobalamin supplementation is added when serum levels are low, which is common because small intestinal disease and EPI together impair its absorption significantly. For bilious vomiting syndrome, feeding strategy adjustments tend to be highly effective. Smaller, more frequent meals rather than 1 or 2 large ones, adding a late evening meal to prevent prolonged stomach emptying overnight, and reducing fat content in the diet. When these measures are not sufficient, we add agents to support gastric motility or reduce acid secretion. For behavioral pica, the approach shifts entirely. Enrichment is the intervention. Structured daily exercise, puzzle feeders, increased social and cognitive stimulation, training sessions, and in some cases, referral to a veterinary behaviorist. Dietary fiber adjustment can also reduce the drive to seek out plant material. Throughout all of these approaches, regular veterinary monitoring is what keeps everything calibrated and effective. Before I close, I want to leave you with something concrete and practical. First, an honest caveat. You cannot and should not try to eliminate grass eating from your dog's life entirely. It is a natural, evolutionarily grounded behavior, and a dog with access to clean, untreated grass in a safe environment is generally fine engaging in it. What you can do is optimize that environment, reduce unnecessary risks, and stay observant. The single most immediate action you can take is verifying what is on your grass. Lawns treated with pesticides, herbicides, and synthetic fertilizers pose real risks to dogs who ingest plant material from them. These compounds can cause gastrointestinal irritation, neurological signs, and, in significant exposures, serious systemic toxicity. If your lawn is treated, keep your dog off it during and after application for the full duration indicated on the product label. And read those labels carefully because many products remain active far longer than most owners realize. At parks, trails, and unfamiliar outdoor areas, the same caution applies, and erring toward the path rather than the grass is always the safer choice. Second action. Do not medicate your dog with human products for gastrointestinal signs you are attributing to grass eating. Ibuprofen, naproxen, aspirin, and other non-steroidal anti-inflammatory drugs we use routinely for ourselves are dangerous to dogs. They cause gastrointestinal ulceration, can trigger acute kidney injury, and in high doses can be fatal. If your dog is showing signs of discomfort, the answer is a veterinary visit, not your medicine cabinet. Third action, assess your dog's diet for fiber content and overall quality. A high-quality food with adequate plant-based fiber reduces the physiological drive to seek out supplemental plant material. Adding a small amount of plain cooked pumpkin, steamed green beans, or a veterinarian-recommended fiber supplement to your dog's meals is a practical and safe adjustment for a healthy dog. It is not a substitute for diagnosis when other signs are present, but as a supportive measure, it is backed by the behavioral data. And above everything else, if the grass eating is increasing in frequency, happening with urgency, or accompanied by any of the signs I described, the vomiting, the stool changes, the weight loss, the discomfort, make the appointment this week. Do not wait for the signs to multiply. The dogs that do best are always the ones whose owners caught the shift early. I know it can feel unsettling to watch something as ordinary as your dog eating grass and suddenly wonder whether it means something more. The temptation is always to tell yourself it is nothing. Your dog seems happy, seems full of energy, seems fine. But I hope this video showed you that there is a big difference between the dog that casually nibbles a few blades out of instinct and the dog that is trying to tell you something with urgency and a pattern of accompanying signs. The frequency that keeps climbing, the vomiting that keeps showing up, the stool that has not quite been right for months, the weight you kept meaning to check. Those details speak, and now you know how to listen to them. If this video made you look at your dog's habits a little differently, do one thing for me this week. Book a checkup if you have not had one recently, and mention the grass eating specifically. Describe what it looks like, how often, what follows. That context is exactly what helps us figure out whether we are looking at a completely normal quirk or a clue that is worth following. And if this was useful, share it with another dog owner, because the friend who keeps laughing off their dog's grass habit might be the person who really needs to hear this. Leave me a comment and tell me, does your dog eat grass? Is it an occasional thing or a daily ritual? Has it ever led to a health discovery? I genuinely love reading those stories. I am Larissa. Take good care of your dog, and I will see you in the next one.